We're live.
Hi, welcome to the first of 4 Facebook Live series that Enloe is hosting this month. Special topics for moms, especially nursing moms with new babies. I'm Deanna Reed, the Community Outreach Coordinator for Enloe Medical Center, and I'm here with Heidi Cantrell, registered nurse and manager of Enloe's Mother-Baby Education Center and Lactation Program. So welcome, Heidi.
Thank you, and thank you all for joining us on Facebook.
Yeah, welcome to our first episode. So today we're going to be talking about the top 10 things important for breastfeeding moms. And the first thing is we've all heard that breastfeeding is the best thing for moms and babies. But Heidi, can you tell us a little bit about why that is?
Sure. And yes, that's true. Studies have found that there's not only a lot of good benefits for baby and mom, but also for our environment and the economy as well. So some of the many benefits for the baby is that there's a lower incidence of allergies and asthma and eczema, as well as ear and respiratory infections, bowel diseases, diarrhea, and childhood cancers. There's also been studies that have found for babies that there's less chance of childhood obesity and diabetes, less chance of sudden infant death syndrome, as well as higher IQs and visual acuity scores. Now, looking at the mom, the benefits of breastfeeding for her are that there's less chance of bleeding after delivery, less chance of ovarian and breast cancer, and also increases the bonding and attachment with her beautiful newborn. We can also say that breastfeeding helps moms get back to their pre-pregnancy weight.
Which is amazing.
Yes. And then for our environment, it helps because it requires less gas and electricity use, and there's no packaging that goes into our landfills, and there's no water or the risk of powdered formula contamination, which could harm our babies. For economy, studies have found there is less healthcare costs, as well as less times that moms or parents have to take off due to their sick child being at home. It saves each family about $2,000 a year in the cost that they would have to put out in order to buy what we call artificial baby milk or formula.
That's a lot.
Mm-hmm.
So how do moms get started and maintain breastfeeding and make sure their babies are getting enough nourishment during that time?
Right. It's important to note that because of these benefits, the Academy of Breastfeeding Medicine, World Health Organization, and also Baby Friendly recommend that a mom exclusively breastfeed her baby for 6 months, and that means no other food or drink other than breast milk, and then add complementary solids at 6 months and continue breastfeeding with solids 1 year on into the 2nd year. So how to breastfeed? In the interest of time, it's important to note that I'm going to give some general ideas, but we go into further information in our prepared childbirth classes, as well as in the hospital. All of our nurses have been trained, because we're a baby-friendly hospital, of 20 hours of mandatory breastfeeding education on how to breastfeed and how to maintain breastfeeding. And then if anything comes up out of their scope of training, then a referral would be sent to one of us lactation consultants. And then after you have your baby, it doesn't stop there. At Enloe, we're here to help you through our parenting series called Bitty Baby and Me. And one of the topics is breastfeeding, although every week the discussions come up about crying and sleeping and calming your baby and also feeding your baby. And so anyway, just to know that it's an ongoing process within our service line, where the how-to and the maintenance is before, during, and after the birth of your baby. We support you through that pathway continuum.
And Heidi, one thing just that we should notice too, or mention, is not all moms are able to breastfeed. Some choose not to, some have difficulties, and that's okay.
Absolutely.
We're here to support them, right?
Absolutely. Being a baby-friendly hospital, what that means is when a mother chooses to breastfeed her baby, we don't do anything to undermine that choice and accept financial kickbacks from a formula company, and that's the 10 steps to successful breastfeeding, as well as the code of marketing. But if upon education to a mom who wants to formula feed, she still wants to formula feed, part of Baby Friendly is ensuring that she does so safely. And then a big component, and I feel the most important thing that you can give your child is a loving relationship. And that attachment and the bonding is the most important thing. So yes, thank you.
And the
for
skin
mentioning.
to skin, that's a big part of it, the bonding, whether you are able to nurse or not.
Exactly. So, in regards to how to, just generally speaking, is that you want to make sure, many times babies will just latch on their own after delivery. It's that innate, natural instinct. As long as it's done naturally, the baby will just track their way to the breast, which is a beautiful thing to watch. But once the baby, just like with parenting, it comes with guidance or discipline to teach with what I call that dance of attunement. So as the baby is being guided to the breast, you want to make sure that their nose is in alignment with the nipple, and then their straight alignment with the ear, shoulder, and the hip are in alignment. And then there's different positions, whether it be across your chest, or some moms like to have the football hold, or also known as the clutch position, or another benefit is just rolling over and then positioning the baby either on the underside breast or the upside breast. But either way, it's making sure that the baby is in alignment and bringing the baby at the breast level. And then there are some cues that you want to watch for. And one of the 10 steps is rooming in. And when babies room in with mom, unless there's a medical indication for separation, in other words, babies need to go to the special care nursery, that we teach our parents to watch for those hunger cues. So we're all different and individual in the way that we communicate. So there's some babies that will just kind of root, and then others that will lick their lips, and some that will bring their hands to their mouth, and there's even some babies that will actually put their whole fist in their mouth like, I'm hungry now. So crying is actually a last sign to say, you weren't paying attention, I'm hungry, feed me. So we want to catch those early cues. And then another reflex babies have is when you take the breast and you stroke the upper lip or the upper lower lip, they'll open their mouth wide, and you want to bring the baby to you, skin to skin or tummy to tummy, and have the nipple facing up to the roof of your mouth. So you can take your tongue to the roof of your mouth and feel where the hard meets the soft palate. That's where the nipple would go. So many times moms will hear, oh my gosh, breastfeeding hurts, you're going to get blistered and bleeding. And that's because the baby will come straight on in the mouth. This is the baby's mouth, upper and lower lip. And then they're just sucking on the nipple, not getting much milk. So therefore, they suck harder. And so in order to make it easier, the nipple goes to the roof of the mouth, and then you bring the chin and the chest in and you open it up, and all the pressure is on the breast, which really helps transfer the milk in well, which decreases weight loss, chance of hypoglycemia or low blood sugar. And so what we teach partners is make sure there's that straight alignment, chin in the chest, and you see a big V. Just like when we drink water, you want your head up for a nice natural flow, as opposed to trying to drink when your chin is down. So in and up, big V here, and then you'll see those deep swallows. And that's how you know that the baby is properly positioned, and then also you can maintain breastfeeding.
That's good to know. I didn't know that. So just real quick, we've had a few people join us, so we want to say hi to everybody who's now online with us this morning.
Hello.
Feel free to type in questions. We'll be looking at comments and questions as we go and trying to field those throughout the next half hour or so. So with that, thank you. That was a lot of great information.
Thank you.
So you talked a little bit about baby friendly. We touched on that a little bit and how important that is and how the hospital helps support that. Is there anything else that the moms out there in our audience should know about baby friendly designation and how that affects what they might experience in the Nettleton Mother Baby Care Center?
Right. In 1940, the World Health Organization and UNICEF had a worldwide summit encouraging hospitals around the world to support moms in breastfeeding and not undermine the initiation of getting started as well as maintaining because of the benefits that we've mentioned. And so therefore, all hospitals, or most hospitals around the world, started to take hold of that recommendation, but it didn't start in the United States until 1991. And we're starting to see more and more hospitals in the United States be able to implement and maintain that recommended high quality of care. I am proud to say that Enloe, at that cutting edge, we really support quality and plain tree, patient-centered experience. So therefore, we try so hard to be at the cutting edge and current and evidence-based. So we were the first in Butte County to become baby-friendly. We were the first hospital north of Sacramento and south of the Oregon border to become baby-friendly. And nationwide, we were the 119th hospital to become baby-friendly. We received redesignation. You have to get redesignation every 5 years. We received redesignation in 2016, and then we were preparing for our on-site redesignation in 2021.
That's awesome. And it really is a testament to the fact that moms are our first priority and their babies. So we really want to make sure whatever the best practices are to help support moms, support babies, and make sure everybody has the best start possible is what all of our nurses and caregivers are doing at the hospital and the education center. So thank you. So skin to skin we talked a little bit about. You talked about a little bit of how to make sure baby's getting enough to eat. Some other things that you had mentioned to me are hands-on pumping and hand expression, things to help increase milk flow if that is an issue.
Right.
So is that something that we can share a little bit with our audience?
Here at Enloe, we have a infant feeding work group. And the feedback was that we want to be able to keep the infant feeding experience sweet and simple. So we actually have a KISS campaign going on, keeping it sweet and simple. Because studies have found that nature knows best and less can be more, especially in the first hour after delivery and in the next 3 days thereafter. So we took a closer look at the larger tertiary centers such as Kaiser and Sutter, and even more so at Sutter Medical Center, and identified that they're taking that same approach. And it's such a respectful way to be able to care for our patients for those healthy and relationship-based long-term outcomes. We want to set our patients up for success. So Jane Morton, who is a pediatrician at Stanford Medical Center, has done long-term studies on the benefits of hand expression within the first hour after delivery, including the importance of skin-to-skin contact. As simple as that sounds, skin-to-skin contact has so many benefits. Perfect place for a baby to go, right on mom's chest, close to the heart. And with her warm, moist body due to the labor or the work of delivering her baby, helps take the baby from the sterile environment into an environment that colonizes the baby's skin with her normal flora of bacteria, thus reducing the incidence of infection. It also helps stabilize the baby's temperature, heart rate, respiratory rate, as well as stabilize the glucose levels. And so, and many times the babies on their own will attach and breastfeed, which is what we call baby-led breastfeeding, which is such a miracle. Yes, all wired and meant to be. And then with Jane Morton's study, because the oxytocin levels, the contractions of labor are still on board within an hour or two after delivery to help contract the uterus and promote involution, going back down into its pre-pregnancy state in the pelvis, that when a mom does hand expression, a lot of milk will be released. So even if a baby is breastfeeding and she's taught hand expression, even her partner can do it, it's collected in a spoon, and then when the baby's done with dinner, can have dessert. And kind of like a turkey dinner. And actually, those babies that are born late preterm or preterm, if they're too tired or too weak to nurse, that hand expression can be collected and saved for when a baby is stable to be able to get her what we call liquid gold, which is the first milk called colostrum. Studies have found the more milk that comes out in the 24 hours, and especially the first, the more will come back to help her milk supply long term. So here at Enloe, we're encouraging skin-to-skin contact, hand expression at least 5 times in the first 24 hours, and then 8 to 12 times in the next 48 hours until that second milk comes in, because we want copious amounts of milk, putting the baby at less risk for weight loss, less chance for low glucose levels, and also less chance of jaundice. And what's so exciting is we taught our nurses this whole theory of KISS, keeping it sweet and simple, based upon Jane Morton's study. And you can go online, and it's called A Mother's Touch, and it's a pretty amazing video that you can watch online on their website, and eventually we're going to have it on our website as well. And we thought, well, it'll probably take, you know, for this culture change, like about 6 months to a year, but the nurses have already been seeing big changes and implementing, so you can see the heart and the care of our nurses. Pretty cool to watch.
Yeah, well, it's a team effort, and everybody really is involved in making it successful, making it simple, making it loving, like you said, and that's so important in those first hours.
Absolutely.
Yeah. So I was looking, and I don't see any questions posted yet. So those of you who are out there, if you do have questions, I might be missing something, but I am not seeing them, so I'm going to keep looking.
Yeah.
But feel free to post them if you do have questions, and I'll keep monitoring here just in case. But in the meantime, then besides all of the great work that's going on in the Mother Baby Care Center and the work that the nurses are doing directly with the moms at the time of delivery, then we also have a really great resource for moms a little bit away from the hospital called at the Enloe Mother Baby Education Center and Boutique. And what we have there is a lot of resources that will help moms, from nursing bras to pumps to wraps and all kinds of things. So we're going to take a break from Heidi and me, and we're going to have Beth, who's our program assistant here at the boutique, walk you on over to the boutique and show you a little bit about what we have there. So welcome, Beth.
Hi, everybody. We're just going to go down the hallway and check out some awesome stuff that we have in the boutique, and also answer some questions that were posted before we went live, to kind of help you understand what we're able to offer here, because it's really, really great resource. So this is just one of the rooms. We actually have 2 rooms available. The other room has mostly pumping equipment, skincare items, things like that. But I'm just going to show you some of the things that we have. The first question that we actually had posted was about how can I get fit properly for a nursing bra. We recommend coming in about 2 weeks before your due date so that we can get you fit exactly the way you're probably going to be after you deliver. So we can fit you with any of the styles that we have here. It's very important to us to be able to fit you accurately, so everyone here has been certified in how to fit a nursing bra correctly, so that you don't end up in a situation where you have mastitis or plugged ducts, or even lowered milk supply, because those things can happen if you have a too tight fitting bra. And if it's too loose, you're just not getting the support you need, and that can cause a lot of pain. We'd love to avoid that, so we don't want to do that. So I'm just going to show you some of the styles that we have. We actually have we have these confetti bras. They're really great for sleeping because they're really soft. Great for the hospital. What? And then we have also underwires, which are really great. These are super supportive, great for nursing as well, and they're kind of fun and really feminine, which is great. And we have these really nice nursing gowns, which is perfect for the hospital. And running around even in the summertime with some leggings, super great. Lots of colors available in that too. The next question that we had was about pumps and how to get one. When should I think about that? We recommend about a month before your due date. You can get that checked off your list and not have to worry about it, which is just one less thing. So we can actually help you. Most insurances now are covering pumps at little or no cost, which is so great. and we can help you figure that whole thing out, because it's kind of confusing. I've had lots of people just call and say, I can't get an answer, but I can get that answer, and all of us can help you with that. So our phone number here to call for that, 332-3970. We're just going to get some basic information, your insurance information, birthday, social, things like that. We can call directly, and we can find out exactly what your plan covers, and then we'll call you back and explain to you what we have. And we have two different options actually for pumps. We have the Symphony double electric pump available for rent as the hospital grade, which is really great. Not everyone needs that, but it is an option, and I know that there's not very many places around that actually do rent them, so we have that. And we have our Pump and Cell Advance, the double electric, which is your pump for purchase. The ones we have a year warranty on them, so that's a really great option. Most moms like that. It's very portable, great for going back to work, even just going to the mall if you need to, whatever. They're just super great for whatever. Very easy to take. Professional grade, and people love them. They work great. So we can do all that for you. Just call us. We are actually here Monday through Friday, 11 to 4:30. The store is open, but call us even if we're not here, and we'll get back to you for sure on that. The other question we had was about breastfeeding pillows, and where do I get that? How does that work?
And we're back.
So we're having a little technical difficulties. Sorry. So we moved location, not in the boutique anymore, but we were talking about pillows. So this is the one that we carry in our boutique. It's called the My Breast Friend. Moms love this pillow because it's a little bit bigger. It has this patented back support, which is really awesome for supporting. Has a little clip right here that helps secure it around mom. And it has this really nice wide platform for baby to rest on. And it helps with positioning because it helps bring baby up to breast level, which is ideal. And it just helps so much with positioning and breastfeeding. And the last question that we had was about pump parts and where can I get them, and baby wearing. So we have to find something or order it and wait for it for weeks and weeks, because we probably have it. So call us and we can tell you over the phone. We'll ask what kind of pump you have and try to get that for you. We have replacement parts like tubing. We have different sizes of breast shields, size 21 to 36, which is great. We also have power adapters for portable power, as far as batteries, vehicle adapters. So we have all those options. And then we also have these skincare items, lotions, and really great stuff that's safe for mom and baby. We have swaddle wraps, which are really good, soft cotton muslin. And then we have Moby wraps, which are really great because we encourage at Enloe baby wearing, and it helps with bonding, and it's just such a great experience, and Moby wraps really help with that. We have great colors in those. So yeah, come see us if you have any questions at all. Again, our phone number is 332-3970, and we're here Monday through Friday, 11 to 4:30, except on holidays. And we're here to help you with whatever you need. And back to Deanna and Heidi.
Thanks, Beth. That was awesome. One thing, just sort of a little teaser for what's to come. Beth, Facebook Live programs this month, we're going to be featuring a little fashion show on how to wear your baby. So make sure you don't miss that. But in the meantime, we did have a couple questions, so we want to go back to those. So Heidi, Melissa and Shandy had kind of similar questions. So they were asking, in the beginning, is hand expression better than pumping to get milk started? And when you do express the milk, how is it best to give that to baby? You had mentioned a spoon, so maybe you can elaborate on that a bit.
Those are two very
we're really excited about. We really think it's going to be a great way to share information, get our caregivers out there, let you have a chance to ask questions directly of them. Technology sometimes is amazing and sometimes it's a little challenging. So bear with us, and thanks so much for being here still. So Heidi, you want to continue on with those answers?
Sure. Those were two great questions, and actually part of the study that was done through Jane Morton at Stanford Medical Center. But because colostrum is very small in amount, in the first 24 hours, it's usually about 5 to 7 mLs. It's very concentrated, very small in amount, thick and syrupy, helps seal the stomach and the intestines, that it's been found that hand expression not only comes out in more volume than pumping, but also there's fat inside the ducts of each of what we call the lactiferous ducts that go into the lactiferous sinuses. And by doing hand expression, it releases more of the fat. So not only will you get more in volume, you'll get more in calories as well. Kind of like a Big Al's milkshake here in Chico. And so, which really helps our late preterm and our preterm babies. And many times babies will be sleepy for the next 6 to 8 hours. So having this well hydration and these calories on board is a great start, naturally made for the baby. Spoons are very economical. They're easy to access. They can be on a patient's tray, and this is what many countries will do. And it is so cute to watch. You just simply put it on the baby's lower lip, and they bring their tongue out and lap it up as though a kitten or a puppy would. And then they have that, that taste like, ooh, that's good, and then they just lap it right in. And when the second milk comes in, as mentioned on the 3rd to 5th day, there's higher volumes. So that can be given through cup feeding, or what we call like syringe and tube feeding at the breast if supplementation is necessary. So we try to keep everything to the breast if possible.
Yeah, get baby used to that positioning and action. So
Right.
Talking about the supplementation, how do women know if they're getting enough milk to the baby, both at the beginning and once that second milk comes in?
Right. Well, here in the hospital, we weigh the baby, which is our measurement to identify the percentage weight loss. And it's not uncommon for babies to lose a little bit of weight in the beginning because they have extra fluid on board from the pregnancy, from moms, and what we call extracellular fluid, and then also the fluids that were given to mom during delivery. Possibly. And so there's what we call diuresis, or getting rid of those fluids within the first 24 to 48 hours. And so we see them lose a little bit, but then we want them to get back to birth weight by the time they're about 2 to 3 weeks of age. If babies start losing too much weight, then we really are proactive in helping the moms with skin-to-skin contact and breastfeeding and hand expression. So that way we can be proactive and not be reactive, dealing with a situation such as hypoglycemia, low blood sugar, or jaundice. But we also look at the measurements of wet diapers. We expect to see the number of wet diapers depending on how many days old they are, up until 6 days of age. So we expect, for example, 1 wet for the first, 2 for the second, 3 for the third, and so on. And then once they're 6 days of age, then we want to see a minimum of 6 to 8 wet diapers. And then by 5 to 7 days of age, we'll typically see about 3 to 6 soiled diapers. And for breastfed babies, usually the soiled diaper is very liquid because it's already pre-digested, easy on the stomach and the intestines. Yellow, maybe a little bit of green in it, and seedy. There are some babies that stool every time that you feed. So stock up on those diapers because you'll need them early on because they eat quite a bit. And we encourage in the first 24 hours, as mentioned, a minimum of 5 breastfeeds, lots of skin-to-skin contact, and hand expression, and giving it by spoon, or what we have in our department are these little snappies, which is like a little cup that babies can be fed after the feeding as well. And then the next 48 hours, about 8 to 12 times, frequent breastfeeding to really get that milk supply established, and the baby to learn how to coordinate their sex, swallow, breathe patterning and transferring the milk. Because we can see that babies inside utero never had to eat on their own. It was just fed to them. Now they have to work to get their milk. And once that is established, then we recommend that you can start pumping and having dad or partner or grandma or somebody else give the baby a bottle of pumped breast milk.
Nice. Start creating those good relationships and bonding for grandparents and dad as well as for mom.
Absolutely.
Awesome. So Susie asked a question, and it's a perfect segue because our next in our list of top 10 things that moms want to know is what happens after leave time is starting to wind down and it's time to go back to work.
Right.
So moms have been pumping, getting their breast milk stored up. You know, what is the best way to help with that transition?
Well, with this good question, 75% of new moms are going back into our workforce in the United States. And so in 2002 and 2015, California breastfeeding accommodation laws went into effect, supporting moms or employees in the workplace as well as women pumping at school. And in our classes, every week it comes up, but in particular there's one class in our Bitty Baby and Me class, and a lot of people call it backpacks and briefcases breastfeeding class. And so we talk about pumping, storing, collecting your milk, and the emotional part of going back to work and how the caregiver is a big part of, you know, this whole infant feeding experience and ensuring that they know how much the baby would take for their age and their weight. And it's recommended to introduce a bottle of pumped breast milk once breastfeeding is well established, babies back to birth weight, and having that 6 to 8 wet diapers. Studies have found that it takes humans about 2 to 3 weeks to develop a habit or a routine and a pattern. So we want to make sure that we got breastfeeding down first before we give a baby a bottle of pumped breast milk. And then it's nice for other people to give that bottle so mom can catch up on her rest or go to grocery store or Target, which could be the highlight of a new mom's life, just being freed of responsibility for a little bit. And also, like you said, bringing in the village and knowing that other people love and love to nurture through feeding. And this helps the baby get used to the bottle so that way it's not new to them when moms go back to work. And so there's a lot of discussions around that. And then also here at Enloe, we have a going home booklet that goes over this information as well. And it is on our Enloe website on the home page. So you can just click on going home booklet and there's a section on breastfeeding that goes over this information as well.
Excellent. So kind of along those lines too, then she was asking how once that you start pumping and you're giving baby some of the bottled breast milk, how do you keep up your breast supply when you're back at work because you're not feeding as often?
Good question. Well, we recommend that moms get what we call a milk bank established. So I just mentioned how important it is to pump and have the baby used to a bottle, but after a week, if the baby's used to a bottle, continue pumping every day, or some moms will even pump twice a day, and then the babies can have the pumped breast milk a minimum of 3 to 4 times a week. And then on those extra days or those extra pumpings, it can be stashed in the freezer. So that way when moms go back to work, they've kind of got that backup until moms can learn how to let down to the pump, because you don't love your pump the same way you love your baby. Not that you want to learn to love your pump, but there's something about those routines and those predictable patterns, you know, setting up an environment that's safe and clean and comfortable, and being able to identify your role in the workplace. You know, now I'm pumping for my baby, and now I'm back, you know, in my role at work.
Right, and that can be hard, switching back and forth, and the emotions do play such a role in the nursing. So you mentioned pumping and putting your breast milk in the freezer. So is it better to keep it in the freezer or the refrigerator? How long does it last once you have pumped and stored it?
Good question. It depends on when it's going to be used. So there's different, I guess you could say, recommendations depending on where you look, but for our recommendation, we tend to go by the 3 to 5. So it can be 3 to 5 days in the refrigerator and 3 to 5 months in the freezer. And we recommend that you don't put it in the door because it's a little warmer. You want to put it in the back of the freezer or the refrigerator. And it can be out at room temperature for 4 hours. And this is breast milk because there's living antibodies in breast milk, which is one of the huge benefits. Is having those antibodies. It's almost like giving your baby a dose of vaccine every time that they get, mom's milk.
Right, because moms have the immunities already built up, and we're sharing that with our babies.
Absolutely. Once the bottle goes into the baby's mouth in the first couple months of life, then it's only good for 1 hour because there's so much bacteria in the human mouth, it can backwash into the breast milk. So that way you kind of have to watch, your amounts, because if the baby doesn't drink that amount and you've had larger volumes than what you would expect that baby to take in, would have to be tossed, which is very heartbreaking for a new mom.
Well, you work so hard to get that milk for your baby. You don't want to waste it. It's pretty precious.
Right. And so what we recommend is that moms have like a plastic box. And in our boutique, we have these bags that you can put the milk into, and you label and date it, and then just put the new ones in the back so it works forward. So you use the oldest ones first. If you have a deep freezer, it can actually stay there for 1 year.
Wow.
So, and so those are the recommendations.
Mm-hmm. That's awesome. So in addition to the emotional aspects and the practical of how to pump, how to keep up your milk, the emotions and work versus pumping it in the workplace, if women have any challenges, there's laws that really protect a woman's right to pump, to nurse, to continue that process when they go back to work.
Right.
So can you share a little bit about that with us?
Sure. That's where those 2 lactation accommodation laws came into effect in California. Many times at California, we're at that cutting edge, and businesses have found a trifold benefit in this family-friendly law, because moms take less time off work for their sick children, and then also there's higher productivity, and then also more retention and less turnover. And so the laws require for students at school or for employers in the workplace to accommodate a clean, private place close to where they're working with an accommodating amount of break time as well as their lunch time to pump their milk. And it is so exciting to be able to see that more laws are coming into effect in order to help moms continue to provide breast milk for their babies even though they're going back to work and back to school.
Yeah, it's great to see so much support for moms and families, and it's very, very refreshing.
Yes.
So, I was just looking, it looks like we do have another question. Megan asks, what are the best foods to eat to encourage milk production? She says, I've seen several teas and cookies in stores that say they promote milk production, but what are your thoughts on these products?
Right. There isn't any magic pill or food. The main thing is just staying well hydrated, and it's recommended to drink to thirst and keeping up your calories. So I always recommend carrying around a tall bottle of water or diluted juice and drink to thirst throughout the day, and eat whole foods. Our main source of nutrition should be fresh fruits and vegetables, and then make sure that you get in enough fat and protein in your diet. They say that you need about an extra 500, sometimes 800 calories, but you want to make sure that they're healthy calories, not Haagen-Dazs ice cream or donuts and all, because that will help your milk supply more than anything. There's theories that say, oh, if you have a beer, some women think, well, if I have a keg of beer, will that increase my milk supply? And actually, that's a myth. Because if you have too much alcohol, that can actually cause a hangover, which is dehydration. So sometimes it's relaxation that brings the milk in and can transfer in the milk, or transfer into the milk. So there's different theories about certain herbs, such as fenugreek and all those different things, which is probably what is being talked about in the teas. But I think that, in my opinion, it may not be the herb, it's the experience of drinking a warm cup of tea, especially if you're used to having that.
And hydration.
Yes.
Yeah.
And so anyway, those are the things that we recommend. And going back to that hand expression, you know, a lot of moms say that when they do hands-on pumping, or they hand express before they pump or during they pump or afterwards, many times they'll get an extra 2 ounces, sometimes even 4 ounces. It's that mind, body, spirit connection. And in our boutique, we do have a hands-free bra. So your hands can be free even while you're working or while you're eating your lunch or drinking your fluids. And then your hands can be free to be able to do some of that hands-on pumping. Those are the things that bring in more milk supply than looking for that magic herb or pill, from my experience and what I've seen. Yeah.
You're right.
Yeah.
It sounds good, but maybe too good to be true.
True.
So the last question in our top 10 is resources. So there's a lot of great community support, a lot of great resources out there. Enloe Medical Center does have a lot of resources we also offer to moms. So if you want to tell us a little bit about that.
Okay, sure. We are so fortunate in this community to have so many breastfeeding resources and education and support. La Leche League is open to everybody. It's a wonderful support group of moms breastfeeding their babies from newborn, you know, up many times into the toddler years. And then also Northern Valley Indian Health has a wonderful lactation program for those that are Medi-Cal. And then the WIC programs, if you're financially qualified and are eligible, can be part of their program as well. Mm-hmm. And here in Chico, the WIC program not only offers the opportunity for prenatal education, but for lactation consulting, as well as pump loans as well. And they help you get your own pump through this resource called Simply Mama. And then hospitals locally have their own programs for breastfeeding education and support. But here at Enloe, I'm proud to say that we have much to offer. Prenatally, we don't look at breastfeeding being separate. We look at it as being inclusive in the childbirth preparation. And we've identified that when dads or partners are involved getting the education, that it provides her with the support that she needs in order to maintain breastfeeding. And then also during the hospital stay, we have that education through our nurses, through our DVD called Hospital to Home, as well as our Going Home booklet. And then after the birth of your baby, it doesn't stop there. We're here for you. And so we've got the boutique, we've got our parenting classes. So when you deliver here at Enloe, you get a free parenting course called Bitty Baby and Me. And you just show up on Wednesdays. They're offered every Wednesday from 10:30 to 12. You don't need to register. You just show up, and then they're ongoing. And we always talk, like I said, about crying, sleeping, routines, patterns, and breastfeeding. And if you didn't deliver at Enloe, we'd love to be able to have you come. There is a $75 fee, and it requires the registration. And it's not only good education from a facilitator such as us nurses, who are international board certified lactation consultants, but it's also the support of the other moms, you know, and the parents, where you don't feel like you're alone. You build your confidence and your competencies, and you know that this is normal newborn behavior, and you know what to expect. And I've seen many moms and partners who have developed really special relationships in our community. In fact, the other day I was at a restaurant, and there were families that were in my Bitty Baby and Me class 10 years ago talking about a PTA meeting, and their kids are in soccer together, and I heard them arranging marriages, and I'm just kidding. But that's the part, that's that community collaborative experience that is so special. And I always say in my classes that the only rules that I have is there's no judgment, no criticism. Perfection does not exist. It's a facade, so you don't have to, you know, do that. Just be who you are and be transparent and Babies can cry, poop, and spit up if they want to. It's like a living room, comfortable environment you can too if you want to. And just love and support each other. So these classes take place at the Mother-Baby Education Center, as Beth had mentioned, 251 Cohasset, Suite 120. And we recommend that you park in the back of the building, and when you enter in, we're on the left-hand side next to the Joint Center. And we have wonderful classes. You can go online to see all of our selection of classes to prepare for childbirth as well as parenting, and then for safety as well. Here at Enloe, we look at this as the family experience. So it's not just about the mom and baby. We want to be inclusive of grandparents.
I was going to say, I was waiting. It's like, it's not just moms. We had the grandparenting class too.
And it is so fun. So we have a grandparenting class. We have infant-child CPR classes. We have car seat and pet safety classes. We have babysitting classes. So, and excited to say that in the future we're going to have marriage and relationship classes next year. So we just keep growing, and we try so hard to have an ongoing quality improvement so we can provide the best care possible for our families who deliver within our organization as well as our community at large. And then you can go onto the website as well as calling, which is 530-332-3970. And we'll be happy to provide the information to give you and your family the best start in life possible.
Awesome. Thank you, Heidi. And I was just checking. It doesn't look like we have any other questions at this time. So any last minute things you want to share with the audience?
Sure. The one thing that comes closest to my mind and heart is that we have an amazing group of nurses, and no one's paying me extra to say that, but they're highly skilled, highly trained, highly compassionate. Here at Enloe, we have continuity of care and education that is current and evidence-based. So we are one. And we have those warm handoffs in the way that we provide our education because we want our patients to be successful. And so when you deliver here at Enloe, our slogan is choose well, choose Enloe. And we're here for you the whole way, the pathway from pregnancy all the way through parenting. And what I hear from the nurses is they say it's an honor to be part of that experience, to watch this beautiful birth and that celebration, the birthday party, and the whole goal is to provide positive, patient-centered experiences and to be the first choice for healthcare. That is our mission here at Enloe, and to have healthy and safe outcomes. And then lastly, our infant feeding program, our purpose is to be able to provide and navigate quality infant feeding practices with compassionate patient-centered care. And I just want to thank you for joining us, and thank you for allowing us to be part of this education, support, and family experiences for you and for our community at large. Thank you.
Thank you, Heidi. So that wraps up our first session, and we have more coming. So I just want to remind you all, we would love to see you back here next Thursday at 11 a.m. We'll have our second session for the month. We're going to have a few of those wonderful nurses that Heidi mentioned joining us next week, talking about their experience as new moms, how they maintained healthy weight, how they got, kept their nutrition and exercise up as new moms and working moms, and all these things we've been talking about here today. And then we're also going to have somebody from Alpha Strong Gym with us who will be showing us some little tips for exercising with baby to keep mom strong after baby arrives. So thank you so much, and we'll see you next week.
Thank you.
Bye-bye.